Hello and welcome to part 2 of pelvis and hip pathology. Okay, well you remember osteoarthritis. We talked about this in procedures 1. This is the most common form of arthritis and certainly it can affect the hip joints as well. Radiographically, remember we see narrowing joint spaces and bone spur formation. So let's take a look at our x-ray. Here's a nice, normal, healthy hip, nice joint space. And then here is a hip with osteoarthritis. Look at how narrow this joint space is. And then you see these little hooks coming off the bone. That is characteristic of arthritis. Okay, good. Pelvic ring fractures. So because the pelvis is a closed ring structure, it's a circular structure here, a severe blow or trauma to one side of the pelvis may result in a fracture site away from the site of the primary trauma. This is why we always include a pelvis x-ray with any trauma. So if I get hit on this side, because the pelvis is a closed ring, it could cause an injury on this side. So again, always include a pelvis with a trauma. Pelvic ring fractures occur more often in men than women, and it's very common that if you have one pelvic ring fracture, you most likely have another. And you can see there's multiple fractures here in this pelvis. Inferior ramus, superior ramus, the ramus on this pubic bone looks disrupted, and here. And then this chart is just showing different categories of pelvic ring fractures. All right, hip fractures. So hip fractures, as you know, are most common in elderly or older or geriatric patients, but especially patients with osteoporosis or avascular necrosis. And remember, that means a loss of blood supply causing tissue death. Both osteoporosis and avascular necrosis frequently lead to the weakening or collapse of weight-bearing joints such as the hip joint. Thus, fractures can occur with minimal trauma. And you can see an example here. Now, this is likely not an elderly person with osteoporosis. The rest of the bones look pretty healthy and dense, but this is an example of an interesting hip fracture, and maybe you've seen hip fractures at clinicals. Interestingly, the acetabulum can also be fractured, and usually acetabulum fractures are caused by high impact trauma, and surgical repair is often required. So here on this hip x-ray, you can see there's an acetabular fracture here, and this is how they would repair that. So kind of cool. Again, if you're suspecting a hip fracture, you may notice the patient has external rotation of that foot, limited motion in that limb, and so you would never frog this patient. You would always do a cross table. Next, slipped capital femoral epiphysis, or SCFE. In slipped capital femoral epiphysis, the top of the femoral head actually slips off the femoral neck. Now, this condition is not well understood. It's not a rare condition, but it is due to the weakness at the epiphyseal plate. So you can see on this pelvic x-ray, here's your epiphyseal plate, and here you can see, so the right hip is normal and healthy. Here on the left hip, you can see that the femoral head has slipped right off of that epiphyseal plate. Males are 2 to 3 times more likely to experience slipped capital femoral epiphysis. Some children will start to limp or feel pain in their hips or groins, sometimes even down by their knees. Other children will feel sudden, sharp, severe pain that will stop them from bearing weight on that affected leg at all. This is more common in boys ages 10 to 16 years old. Overweight children are at a higher risk for SCFE, as are children with a family history. This is an urgent condition. Surgery is required to place screws in the femoral head and neck to stabilize this bone. Again, we want to avoid any necrosis or tissue death occurring because the blood supply has been disrupted to the femoral head. So it's really important that this is treated pretty quickly. Okay, that is the end of our hip and pelvis pathology. Just remember to be careful out there.